Welcome. My name is Grant Hennington. I'm a physical therapist at Salmon Bay Physical Therapy in Ballard, and I'm joined here today by two of my friends / colleagues, Trevor Davis and Grace Lautman. Would you guys like to introduce yourselves?
Sure thing. Yeah, so my name is Trevor Davis. I'm a rehabilitation psychologist. I work in Seattle. I have an office in Ballard. I actually share an office space with Grace on Fridays, and I'm also doing telehealth appointments. So video appointments to anybody in Washington. And I mostly specialize in chronic pain management.
Awesome. My name is Grace Lautman, and I am a licensed mental health counselor and a certified nutritionist. I have a practice in Ballard, Honor Nutrition and Counseling, and I specialize in relationship with food and body.
Great. Well, thanks for being here today. The three of us had planned on putting on a kind of a public health seminar via the integrative health approach at Salmon Bay Physical Therapy in March, but unfortunately had to cancel due to the ongoing pandemic. So that brings us to today, our virtual meeting that we're holding. We wanted to do kind of a Q&A integrative health discussion surrounding being healthy during quarantine, which we're all trying our best to do right now. So I'm going to kick it off by asking a question to Trevor. A lot of folks are feeling rather stressed and anxious right now, myself included, because of the uncertain times. What are some things you're recommending for people to do to combat this stress and anxiety that is both healthy and productive?
Yeah, I think you're totally right. I think a lot of us, probably everybody to some degree, is feeling a heightened level of stress. I think when I think of that, some of the stress is not actually bad, and it's pretty understandable and normal for everything that people are going through. There's a lot of uncertainty, a lot of changes in routines. So my general advice for people is to have some practice of self-awareness and checking in with yourself, like, how am I doing? Maybe the stress is actually serving them well, and it's motivating and helping them to take care of some problems. And then there's also some of that stress that's probably getting the best of us when can't stop thinking about things or kind of ruminating over and over about the what ifs or the uncertainty that's going on. So then I think it's really important that we all have whatever works best for each person, like having some kind of routine, like trying to keep to a schedule that is good for you now. It might be really different than before. But things like trying to keep a regular sleep schedule, trying to get some physical activity every day, socializing with people, and also making time for fun. I think there's at times some people get kind of this pressure to be really productive. And if being productive and having projects feels really important to someone and it feels like a healthy way of coping with stress, I say go for it. But I think people giving themselves permission to also just relax, to veg out and watch TV every once in a while. Those things are all totally okay too. So do what's right for you.
Great. Thank you. And then to Grace, the quarantine's forced me to cook a lot more than normal, which is a net positive, but it's also seemed to turn me into a bit of a cookie monster. What tips can you provide to promote healthy eating during a very uncertain and unprecedented time?
Yeah, well, I think that is a really common feeling people are having. A lot of food stuff, a lot of our relationship with food stuff is popping up and kind of like in our face more when we're in a time like this. So, and I also would just like caveat it by saying that it is normal to be going to food more for enjoyment and pleasure right now, because we don't have a lot of options in a lot of ways, right? It's like pretty accessible to find enjoyment and pleasure in eating, and in the grand scheme of normal eating, we include pleasure and enjoyment as a part of healthy eating. I think the thing that kind of, when we start to run into maybe more problems that we need to look at more is when we're really feeling like out of control with our eating, or we're really feeling like I don't even remember eating all those cookies, or let's see, like just the shame and the guilt around it too. Like if, you know, that's coming up, just preoccupation, right? And maybe I'm not eating all of them, but I can't stop thinking about them. And that's driving me crazy. And I'm in this kind of restrict, like push and pull with them, like trying not to, but I really want to. Mm-hmm. So it's different for everybody, kind of like what that looks like. But I would say in general, kind of what not to do, and what's intuitive for a lot of people is to like really stop baking completely. Like no more cookies, like we're not doing this anymore, right? Like it's over. And I would say to instead kind of move, I'll give you kind of some of the tips and tricks I usually tell people. So first and foremost is just don't make that food off limits. Actually create permission with it. So the way that you would engage in self-talk with yourself would be, I'm totally allowed to have these cookies. I can have as many as I want. I mean, I'm not a bad person unless I'm like killing someone with the cookies that I just ate. Like right. It's fine. If I end up eating more cookies than I wanted, like it's fine. But giving yourself the choice, right? Creating more awareness around it. So, okay, I'm noticing like I've had 3 cookies and I'm feeling like I really want more, but I'm also feeling really full now, or whatever. Or I didn't eat lunch. I've just been eating these cookies. And then giving yourself the choice, like I can have more later. And that's a really key part, because our brain really doesn't like no's. It's really, and if you say, don't do this, all it thinks about is doing this one thing. So you give yourself the choice, and you tell yourself, if you've decided or you're wanting to kind of stop eating the cookies at that time and are going, I think I need to like actually have a full lunch. Then you just tell yourself, we're going to do the full lunch first, putting the cookies aside. It's like how we would talk to a kid. You know what? Maybe we'll pull the cookies out after dinner, and we'll have some cookies after dinner and it'll be great. And that's kind of, that's kind of like what I would say. So, and definitely during quarantine, like, are you still getting in full meals? Because if you're not getting in full meals, your body's naturally going to want to go eat a bunch of other stuff. So just kind of like thinking about those things. So I think that's kind of my go-to. The other thing is really plating the food. So a lot of times we just end up with our, the cookies that are on the on the rack, and we can actually put them on a plate. So plate yourself more than enough, like how you would serve another person. Because again, if I just serve myself one tiny cookie, that's kind of this like very limiting thing for my brain. It's like, oh, I can only have a cookie. So give yourself 3 or 4, and then be mindful when you're eating it. Like be there for the experience. Don't just feel guilty about it, or, like I'm just going to eat them all now because I want it over with. Like slow down.
Sure.
So that's kind of my advice there.
Awesome.
Okay, let's see. So Grant, my question for you is, what do we kind of do about when I'm finding a lot of times that there'll be like 30 minutes between a call or 30 minutes between a session. And, maybe me and other people, like sometimes there's just not that feeling of like, I don't really want to go do a workout. I don't really want to like work up a sweat, but like, I also like feel stiff and kind of not so good. And I've been like hunched over my computer.
Yes.
What can I do that would be like low stress?
I mean, that's a great question. And I'm definitely finding right now people are feeling a little bit more stiff and sore because they've been working from home at workstations that are not necessarily ergonomically sound. But there's still plenty we can do. The first thing is I usually recommend for people to get up at least once per hour, ideally once per 30 minutes, but that's not always realistic. So try to get up and move around on the hour, every hour. And then I usually encourage people to focus on exercises that will loosen up the areas that tend to get stiff when we sit a lot. So if you think about what those areas are, they are our thoracic spine. So the part of our spine that's between our shoulder blades, that tends to get stiff when we kind of slouch, and Trevor sits up a little straighter now. So there are some great exercises you can do from your home using a foam roller, or just having kind of a mat set up on the floor. And we have videos of those on our website. But then if you're wanting something that's more kind of fitness based, not necessarily tied into all the sitting that you're doing, but let's say you want to do something to strengthen your core, there are lots of great mat-based Pilates and yoga type exercise routines out there. We have on our website a really good core strengthening progression video of like various planks and side planks that you could do in 5 to 10 minutes that aren't going to work up a big sweat or anything like that. And then I encourage people to utilize like a stretching routine that feels good to them. We have a stretching and foam rolling routine for runners on our website, but it's not exclusive to runners. Lots of people would benefit from it if you're sitting a lot throughout the day. And then finally, I've just been encouraging people to get outside and go for walks if they feel comfortable. We're still allowed to be outside as long as we're not congregating in groups. And so just getting out for a walk around the block, especially if the sun's shining, can be really therapeutic for people.
That's helpful. Awesome. And then I guess kind of connected to that, then Trevor, I've noticed a lot of times too in working with clients, and part of my work is about kind of reducing like, the shame around, well, what if I don't want to exercise? And what if I kind of was thinking about, well, what other things can we do that don't involve exercise that are a part of taking care of our body still? So that, because I'm hearing a lot of like, well, by the end of the day, I feel like I should go outside or I should work out, but I really am just like tired and I can't get off the couch, and like creating permission around that. But still maybe like, are there other things that we could tell people? Well, there's still other ways you can kind of think about taking care of your body from the couch or your mind from the couch.
Mm-hmm. Yeah, like the other self-care practices.
Yeah.
I think that one practice that I do for myself, and I also often will work with my patients with, is kind of asking ourselves, what do I want to feel today, or how do I need to feel? Checking into like, maybe I want to feel relaxed today, or I want to feel productive, and kind of asking yourself that in the beginning of the day. It could also be in the after the day, kind of winding down, like, how do I want to feel tonight? I want to feel engaged or interested, or and then kind of letting that feeling or that value kind of guide the action or the behavior, the activity that you might partake in. Sort of values-based goal setting. And I think it gives us all a little bit more permission to check in with how I'm doing today and what do I need today, rather than feeling this forced expectation that I'm supposed to follow this, this outline of everything I'm supposed to do every single day. Because I think it is really important that we all tailor our expectations of ourselves, make sure that we're taking care of what we need for that day in that moment. So how do I want to feel? And then let that kind of guide some of your choices. Yeah.
I like that. Awesome.
It looks like maybe it's my turn now. Yeah. All right, Grant, this one's coming to you.
Oh boy.
Or maybe I'm supposed to ask Grace. Either way, both are going to get a question. I'm going to start with Grace, just because, Grace, you haven't been able to talk here for a while.
Thank you.
So, Grace, I know that in our talks before this and working with you, you do a lot of work with people and how they relate to their physicalness, like their physical bodies. Mm-hmm. How have you seen the stress of COVID-19 impacting some of those relationships to ourself, like how people are relating to their bodies? And what tips do you have, maybe like top 2 tips on how people can best take care of themselves and that relationship to their physical body?
Well, I guess what comes up for me is body image. So I don't know if that's exactly what you were pinpointing, but definitely that's what I'm finding myself talking most with people about is sort of, and in both, I've really seen both, it kind of go both ways, where some people are finding that body image is feeling a little easier because they're spending less time actually on their bodies. They're spending less time putting makeup on in the morning, trying to look nice for their colleagues or whoever. And one thing that we know and that research shows is that less preoccupation on the body causes better body image. So the misconception about body image is that body image means, oh my gosh, like I love how I look every day. I love it, and it's like, that's not really what good body image is. Good body image is hopefully not not liking your body all the time and hating it, but it's also just being able to take it for what it is and have your feelings about your body that one day and then move on. So it doesn't completely take over your day, and so that you're not treating it like it's the most important thing about you. And so, yeah, so I would say if you are struggling with body image right now, one of the best things you can do is to try to put less emphasis on it. So that means if you're in front of the mirror and finding yourself like analyzing things too much, you just go, oh, okay, well, oh, well, and you walk away. Like it's a moment, it's not avoidance. So we don't start avoiding the mirrors completely. We take a moment and then we move on, that sort of thing. And then just to recognize right now that like, and again, research shows this too, is that your body, like if we're trying to be healthy right now, your body needing to be like not gaining some weight during quarantine or whatever, that's not really important right now. We can handle some body change. Bodies are good at that. The body fluctuates throughout life and it's going to change with life circumstances. And a quarantine is a really understandable reason to have some fluctuations. So to just be really gentle about that and keep the focus on how am I feeling, how am I eating, how am I moving, or how am I needing rest, and just kind of like keeping the picture off of your body, keeping your motivations from a place of what's feeling good versus how do I not change or change my body, that sort of thing.
Yeah, that's helpful. Sounds like giving ourselves more permission and kind of compassion with the challenges we're all facing. Yeah.
Totally. Yeah.
All right, Sir Grant, your turn. On a personal note, so selfishly asking you a question about me, but maybe it'll help others too. Because of needing to stay home a lot, I've been going on a lot more walks and even started kind of running maybe a bit more regularly, more frequently than I was before.
Sure.
So what would you encourage me or maybe others who are starting to do more physical activities they weren't doing as regularly before? Like what are good before and after strategies when it comes to taking on a new physical activity? Like you talked a little bit about this before, so maybe just highlighting it again for me. But stretching or warm-ups or a cool down, like what's important for us to skip on?
Yeah, the first thing that's important is to set a goal for yourself. So if you're running more, trying to figure out, are you trying to get somewhere? Are you just doing it for physical activity? But kind of setting up a realistic goal for it is important, because the research suggests that when we have a goal, we're more likely to be compliant with the exercises that we're doing. And the goal should be meaningful as well. And then once you've selected a goal, the goal should be realistic, but then it should also be timely in that you need to build up slowly. So the primary reason people get injured when they run is because they are running too much, or they're increasing how much they run too quickly, or they're increasing the speed with which they run too quickly. So for you, I'd recommend, if you're running more, making sure that you're paying attention to how much you're doing on a weekly basis and you're not progressing that too quickly. In general, we don't want to exceed a 10% increase in our mileage per week.
Okay.
And that's the upper limit. That doesn't mean that you can increase 10% and you're going to be fine. We just find that the risk of injury goes up exponentially over 10%. So progressing slowly, and then still kind of giving yourself the flexibility to skip a day if you're not feeling it, or to run back-to-back days if you're feeling really good. So don't be overly rigid in the routine that you're following. As far as exercises that you can be doing, I recommend everybody warm up before they go for a run or even a walk. So doing some form of dynamic movement. There's a video of this on our website, but there's lots of dynamic warm-up videos out there for people to look into. And then when you get done running, I recommend stretching, or if you get done with a long walk, stretching, because especially around Seattle where there's a lot of hills, our calves can get kind of tight, our hamstrings can get kind of tight. So making sure that we don't just finish the run or the walk and plop down on the couch, because then things can really tighten up on us. And if we do that over the course of weeks, those muscles will start to get used to being tight, which can be problematic. And then I usually encourage people. I encourage people, if they're sore after a run, like try some ice, like a good cold pack on your knees or your ankles or your feet can be really, really helpful if you're sore.
Nice.
Now to Grace for her question.
Well, okay, I just had one question about the stretching.
Yeah.
Is it, what do you recommend in terms of like I remember hearing at one point, like you have to stretch for at least 30 seconds, or it's actually better to do short spurts of stretching. Like what's the latest on that?
Sure. So it depends on when we are performing the flexibility or the mobility exercise. So before an activity, we usually encourage dynamic movements. So think of like jumping jacks or like walking lunges or like a walking knee to chest, things like that. So we're not holding the stretch very long, but our goal is mainly just to warm up our muscles. But then after a run or after a bike ride or after swimming or something like that, static stretching is recommended. And that's holding a stretch for, yes, about 30 to 60 seconds. The stretch should be held gently. So this idea that you really have to feel it and it needs to be really intense. Not only is that not true, but that's probably actually not as effective of a stretch as a gentle, prolonged stretch. So yeah, I really encourage people to do prolonged stretching the muscle groups and joints that they use.
Uh-oh. We're just going to give a moment and see if these two come back. There we go. Nice.
Technology.
Yeah, that might have been me. Either way, real life, folks, this is what happens.
Right.
But we're back.
So moving forward, selfishly, if I were to want to seek consultation from either of you, how would I go about doing that?
Yeah. Grace, do you want to start?
Yeah. So you can just go to my website, honornutritioncounseling.com. And once you get in there, you'll see an online scheduling and contact page, and you can send me a message on that page. Let's see. I also have an Instagram. If anybody's looking for support around relationship with food and body, I post support on that page, sometimes with kind of a comedic viewpoint. So feel free to check that out too. But yeah, contacting me through my website is usually the best way to go.
Cool, and here's that website there. Anyone wants to find it.
Cool. Trevor?
Yeah, I would say probably the best way right now is just to find me online. I'll also here share my my screen, my website. So there's Grace. Here I am. So drtrevordavis.com. Here's my contact info. You can phone me. You can also email me through the website. And yeah, that's the best way. Reach out. We can talk on the phone, see if I can help. Be happy to hear from you.
Great. And you guys are both accepting new patients right now, or just current patients, or?
Both.
Yeah, I'm accepting some new patients. I'm taking maternity leave in July, so yeah, it's kind of a case-by-case basis depending on what people are needing, but I also have a lot of awesome referrals, so people are always welcome to reach out and I can make sure there's a good home for them.
Great. Yeah, cool.
And how about for you, Grant? How could people reach out to you if they're wanting some help right now?
We'll stick with redundancy here. I would say also going to our website. So it's salmonbaypt.com. On our homepage, there is a button to request an appointment. There's also a new feature, an Ask a PT feature. So when you click on that, it pulls up a kind of a text box that you can type your question into. Those are getting sent to my clinical email address, and I typically am responding within 24 hours.
Cool.
Giving some guidance if people need exercises they can do from home, or if I think they need a more thorough evaluation. We're currently treating people in the clinic on a case-by-case basis. We're primarily seeing only urgent medical need patients in the clinic. So if you had a surgery recently, or if you have a really significant acute injury. Otherwise, we are offering telehealth appointments to the rest of our clientele. So if you're interested in that, just check out our website.
Nice.
Yeah.
Awesome.
Well, thank you guys for joining today. I know this was a bit impromptu and not what we had initially set out to do, but I enjoyed kind of talking with you and learning a little bit more about what I can be working on during quarantine. Hopefully, we will be able to schedule our in-clinic health seminar that we had initially planned once the quarantine's lifted. But until then, hope you guys stay healthy, stay well, be safe, and hope to see you again soon.
Yeah. Thanks for having us.
Thank you.
See you guys.